Hello, dear audience. I'm Ritika Bose, your host, back with yet another episode of Health Par Charcha. Today we have with us Dr. Himani Pandey, Lab Head Clinical Genomics, Redcliffe Labs, who has done her postdoctorate fellowship from SGPGI Lucknow and has more than 16 publications in international journal in her name. Hello, Doctor, and welcome to Health Par Charcha. Doctor, today we would like to know more about rare diseases from you. How are rare diseases classified?
So rare diseases are typically classified based on the various criteria including prevalence, etiology, symptoms and the organ system affected. So if we talk about the prevalence in India, ICMR, Indian Council of Medical Research, has estimated that disease with the prevalence less than 1 in 2,500 individual can be considered as rare. So there are 5 to 7,000 rare diseases still reported, and some of the rare diseases are DMD, Duchenne muscular dystrophy, SMA, hemophilia, thalassemia, cystic fibrosis, LSD. So there are many more rare diseases affecting individuals in India. So these rare diseases can be categorized by the genetic rare diseases and non-genetic rare diseases. So rare genetic diseases results from a mutation and alteration of the gene, and non-rare genetic diseases caused by the infection, environmental factor and some other unknown causes.
Doctor, how likely are rare genetic disorders to pass down in a generation in a family?
So rare diseases pass down generation in the family, so it depends on several factors. Including like specific mutation is responsible for the rare genetic disease, and family history of the parent, and inheritance pattern of the disease. So there are four mode of inheritance. One is autosomal dominant. In this condition, child has 50% chances of inheriting the disease if one parent is carriers of a copy of an abnormal gene. And in autosomal recessive condition, both parent must have a copy of abnormal gene. So in that scenario, child has
25% chances
of inheriting the disease. Third is X-linked dominant. In this condition, child has 50% chances of inheriting the disease, whether it is a male or female. Fourth is X-linked
recessive.
So in this condition, primarily son will be affected, and 50% chances that each son inheriting the disease. But sometimes new mutation, which we call de novo mutation, is responsible for the rare genetic conditions where there is no family history. So understanding of the rare genetic conditions, genetic counseling will assist the family and to understanding the rare genetic conditions and the risk factor of the rare genetic conditions.
Doctor, are there specific genetic screening tests available to identify rare genetic diseases?
Yes, so there are many genetic testing available with us to diagnose a rare genetic disease. So this include various techniques and technology and aimed at to find a causative mutation for this rare genetic diseases. So these mutation can be a point mutation, insertion, deletion and duplication and some other genetic variation. So DNA sequencing is there, whole genome sequencing, whole exome sequencing, some target sequencing panel is there, chromosomal microarray and MLPA. So these genetic testing plays an important role to diagnose a rare genetic disease.
Doctor, can rare diseases be cured?
Very few are curable, but it depends on the various factors, including like specific rare disease and its underlying causes. Some of rare diseases have well-established treatment like PKU, phenylketonuria. So it can be managed with the dietary modification. And in case of the thalassemia, so there are bone marrow transplant and iron chelating therapy and blood transfusion is available. If we talk about LSD, lysosomal storage disorders, so this is the group of the rare disorders which is characterized by the enzyme deficiency. So enzyme replacement therapy are available in the market for some LSDs like Fabry, Gaucher, Pompe and MPNs. So not all rare diseases currently have cure, but some ongoing research and medical enhancement offers for hope of the future in terms of the developing the treatment of these rare genetic diseases.
Hopefully in the future we will have cures for rare diseases. Thank you so much, doctor, for joining us and enlightening our audience about rare diseases and the way forward.